M2 is a pediatric dental practice. We specialize in treatment for children. We see children as young as 1, and sometimes we have a difficult time graduating them from our practice. Typically, by 18, you would think a lot of our patients would go on and move on to mom and dad's general practice or family dentist, but a lot of them want to stay with us because that's who they grew up with, and that's what we want. We love that. We consider that almost like a compliment that they don't want to leave us. Our practice values one-on-one visits with children, and we want to be able to provide a positive experience for that child every time they come in. That is our ultimate goal. When designing this practice and this office, we wanted to make it a fun environment for the kids. Children have short attention spans and they get impatient. That's the last thing I want, is an impatient child already bored because they were waiting in the waiting room for half an hour. Kids love video games. That's what we wanted in our waiting room. We wanted it to be sleek. We wanted televisions, that children can watch TVs and be distracted by that while we're doing the work. We wanted it to be modern, we wanted it to be bright, and we wanted it to convey a feeling of openness, which is why we don't have a lot of walls. We have glass. We try to make sure that there's music for the teenagers, and we also provide enough space here that the children can actually be in the room with their parents when they're getting their treatment done. So when they're here for their cleanings, we have seats available right in front of the children's dental chairs where the parents can interact with the child if needed, interact with me, ask questions if they need to ask questions. We're right there with them. We always try to keep up with what's new in dentistry. I'm a member of Catapult Education, which is a group of dental professionals from across the country. I find that it keeps me abreast on what's new in dentistry, especially in the field of minimally invasive dentistry. That's the new paradigm in pediatric dentistry, and sometimes it's provided without drills, without anesthesia, and it provides for a better visit for that child. It's not all dentistry. We don't sit down and immediately open your mouth. Who wants to do that? You want to get to know the person first. I'm on social media, I know what's hip, I know what's new, and if you don't know that, call it a day, go home. Because kids can see when you're not being authentic. The best part of my day is really when a child gets up from the dental chair and they give me a fist pump or a high five, or they want a hug. That is the reward for me, as I reward them with a prize at the end of the visit for being so good for me and for making my job easier and happy. We want that happy visit, so we want them to leave with something, a token. It's a token of appreciation for a job well done.